Hi, today I'd like to talk to everybody more about a controversial topic, which is about hysterectomy. Hysterectomy is the surgical procedure of removal of the uterus. Now, in Antai Hospital, we believe that hysterectomy should only be done under conditions if the underlying cause is malignant and is potentially life-threatening to the patient. Otherwise, we do not recommend hysterectomy. But in today's world, especially in the statistics, we can look at the United States. Hysterectomy is the second most commonly recommended and practiced procedure in OBGYN. So it is very blatantly recommended to patients. And today I'd like to talk to you about the dangers and side effects of hysterectomy. So I'd like to repeat again, unless it is malignant or life-threatening to the patient, we do not recommend hysterectomy. Hysterectomy is not required. So the first side effect and potential danger of a hysterectomy is the uterus acts as an anchor and a support base for the pelvic organ and the pelvis itself. So when you remove the supporting base, which is like the base of a building, the pelvic organs, and especially the pelvis, will start sagging downwards. So you will feel immense pressure in your pelvis because the uterus acts as a base with several ligaments that is connecting towards all the pelvic organs and also the structures of the pelvic bone. So it is a support base that will hold up the organs. So now that you remove all these ligaments, there are up to 8 to 10 of ligaments that are very important for the structural integrity of the pelvic organs. Now that it is removed, your organs will start sagging, and then you experience bulging in your pelvis and immense pressure. Secondly, is the women who remove their uterus will no longer menstruate, which means you are having an absolute infertility. You no longer have the ability to bear children. But of course, this is a very optional and subjective side effect. Some people do not wish to have children anymore. So this may not apply to everybody, but this is a fact. Thirdly, due to the absence of the uterus, there are several organs around in the uterine pelvic region that will be affected. For example, you will experience urinary incontinence or trouble of urinating, because when the uterus is removed, the bladder, which is directly in front of the uterus, has nothing to support it anymore. So it will shift backwards. Once it shifts backwards, it will give you potentially, you may face the symptoms where you're unable to empty your bladder completely because of the shifting of the position of the bladder, and you may have trouble urinating even when you have the desire of urinating. And then the next side effect is very similarly to this bladder shifting. When you remove the uterus, not only does the bladder shift, there's another component that also shifts, which is the large intestine. So the large intestine will also shift forward, and once it shifts forward, it will cause constipation. So you will, even though you have the desire or the urge to go and defecate, but because of the misalignment and the new shifting, because of the absence of the uterus, you will have constipation. Next up, another very distinct side effect of hysterectomy is that you will no longer experience orgasms, because it is the contraction muscles of the uterine walls that is causing the orgasm. So you will no longer have climax. And then subsequently, because of this will affect many marriage lives, and will lead to a lot of divorce rates. I mean, this is also another subjective side effect, but this is a potential side effect and potential danger of hysterectomy in the perspective of society. And then the seventh side effect of hysterectomy is that there are several reports and studies that show that after the uterus is removed, women go into chronic depression or chronic mood swings or mood instability, because the uterus is also a very core component of the endocrine or hormonal system of the body. So when the uterus is no longer there, it will definitely affect the mood of the patient. Because there are several vessels and nerves that are connected towards the between the organs in the pelvic region and also the uterus. A very important organ here that will be affected is the ovaries. There is a direct blood vessel that supplies blood to the ovaries that is coming from the uterus. So when the uterus is removed, it will also lead to a insufficiency of the ovaries, which means the functions of the ovaries will drop, and this will lead to an accelerated onset of menopause. So that means that you will experience menopause faster than patients with people who have a uterus, because of how the ovaries are affected. If the ovaries are affected, certain hormones and the egg cells are not being produced, certain blood vessels are being affected. This will all trigger early onset menopause. It may come 5 to 10 years earlier. So I hope this video gives you some awareness about the dangers of hysterectomy, and always think twice. Always get a second opinion before you go for this such a major surgery. Unless it is malignant or unless it is life-threatening, we do not recommend hysterectomy.